Good morning, everyone, and welcome to our July Security Health Plan Academy webinar. Today, we are fortunate to have Amanda Hodel, a physical therapist at Marshfield Clinic Health System, here to discuss physical therapy for pelvic health. Urinary incontinence is a common issue for both men and women as we age, but it doesn't have to be your new normal, and it can be addressed conservatively through physical therapy. Today's webinar will explore what physical therapy can offer to improve your quality of life. Amanda earned her doctorate in physical therapy from the University of Wisconsin-La Crosse and holds a bachelor's degree in athletic training. She is a board-certified orthopedic clinical specialist with Certificate of Achievement in Pelvic Health. Our in-house expert treats various orthopedic injuries, including women's and pelvic health, pregnancy and postpartum care, post-operative conditions, sports or work injuries, and she also performs dry needling. There was much interest leading into today's topic, and many questions were submitted in advance that we'll want to get to. So without further ado, please join me in welcoming Amanda.
Thank you all for joining today. I hope this is beneficial. It's something that it is very prevalent and a lot of people experience, and there's a lot of things that we can do. So thank you all for being here, and I hope that everyone finds this informative. So there we go. Ashley kind of already introduced some of this, but just about me. So I graduated from UW-La Crosse, have my bachelor's degree there, and then my doctorate from UW-La Crosse as well for physical therapy. In 2014, I was board certified as an orthopedic clinical specialist. I started seeing some pelvic health in about 2019, both through some personal experiences and just realizing in the patient population I was seeing how necessary and prevalent this was. I received a Certificate of Achievement in Pelvic Health in 2022. So I'm a physical therapist for Marshfield Clinic Health System. I work at the Oakwood Center in Eau Claire. And outside of work, I enjoy spending time with my family, extended family. My husband, I have 3 boys, so being active is a part of life for me, and I feel like that's something that should be something that everyone should be able to continue to do, no matter what we experience through life, and just being outside. So general disclaimer, so all of this is general information, not meant to be or substitute for any individualized medical advice or treatment. And any of the products discussed today, I have no financial gains to be made from any of them. Physical therapy for pelvic health really ranges through a lot of things. So it's applying kind of the general orthopedic knowledge and skills to that area of the body. So the pelvis, lower abdomen, lower back. Urinary incontinence is one of the most prevalent things that we see. This can be stress incontinence, which is more leaking with coughing, sneezing, laughing, sudden movements, jumping. Urge incontinence is more you get that strong sudden urge and feel like you have to get to the bathroom right away. And then mixed incontinence is a combination of those two. Overactive bladder is another term that or diagnosis used more so for that urge, urinary incontinence. We also see bowel incontinence or constipation, can be on either ends of the spectrum there. Prolapse or heaviness, pressure feeling felt in the lower abdomen or pelvis. Pelvic pain or pressure, pain with intercourse or with pelvic exams. Pregnancy related or postpartum back pain, groin pain, or pelvic pain. Diastasis recti or laxity of the muscles where they attach in the middle of the abdomen. Tailbone pain, lower back or hip pain, and then scar tissue restrictions anywhere throughout the body, but specifically with C-sections or a episiotomy or a perineal tear after labor, after hysterectomy, or any other abdominal or pelvic surgery that may have resulted in any scarring. And then radiation can also cause some scarring. A lot of times when I'm seeing people too, it's not just one of these things that we're treating. Usually people have multiple things going on, have had a history of back pain, and have urinary incontinence. So a lot of these things can overlap, and important to address all of those issues. So urinary leakage or incontinence is a condition when there's involuntary loss of urine. This can occur again with coughing, sneezing, or movement, which would be that stress incontinence, or that incontinence that occurs with that strong sense of urgency. Again, this is extremely common, but does not have to be normal. There are things that we can do to address this. So, did you know that nearly half of all women will experience some loss of bladder control at some point in their lives? A quarter of women ages 30 to 59 experience bladder leakage. This can affect women and men of all ages. And then as we age, so specifically in postmenopausal women, can be up to 70%. Most women will wait an average of 7 years before even mentioning this to their doctor. A lot of times I hear, oh, it's normal. My mom, my sister, my friends, we don't make me laugh. I'm going to pee my pants, that it's just normal. But it doesn't have to be. So it's a long time before people even talk about it. And then sometimes it's longer before they actually are given the proper care. This is also very common in men. In men, it's probably seen less often just because they talk about it even less. So the number of males that I see, I would bet there's probably at least double, if not more, males out there experiencing very similar things. Bladder problems are common, but again, not inevitable or normal. And most of these bladder concerns can be treated conservatively, so without necessarily medications or surgery. And you really shouldn't have to memorize and know the location of every bathroom wherever you go. So what is normal? Normal for urinating is the ability to go about 3 hours between voids. So that's about 4 to 6 times per day, and 1 to 2 times per night. So about 8 times in a 24-hour period is considered normal for urination. We should urinate about 10 to 12 ounces of urine at one time. So a little over a cup of urine each time. Not having routine leakage or having to need a pad just in case. Not feeling like you have to restrict fluids to try and avoid leaking or having to go to the bathroom as often. And then the ability to reasonably hold that urine even when you get that urge. And then again, not knowing the exact location of every bathroom within a 50-mile radius. So this urinary incontinence is something that can be helped with a physical therapy program that teaches you how to strengthen and coordinate some of those deep muscles within the pelvis that are involved with bowel and bladder control. These muscles can become weakened over time from various things: childbearing, labor and delivery, various jobs or lifestyles that may either involve more lifting or heavy manual labor, or a very sedentary lifestyle or job, and can also be in response to hormonal changes. Some of those hormonal changes are, again, as we age, hormones change, especially females in that menopause period. But also some of these things can be affected by surgical interventions, medications, either side effects from medications, or other medical treatment options that are used to manage things, but radiation, chemotherapy, hormonal therapy, again, can have an effect on our anatomy and how things are functioning that can be addressed. So why is it important to address incontinence? So obvious reasons for avoiding that constant stressor or the inconvenience of having to urinate all the time, but also specifically that quality of life. It is associated with a decreased quality of life, that fear of leaking or constantly thinking about where the bathroom is. And then especially when it gets to the point where people are avoiding activities or events or seeing people that they want to be able to see or do things because of that fear, or just not having to then deal with the possible bowel or bladder issues that they may have. Also, urinary incontinence is addressed with falls, which then were more likely to result in fractures. Sleep disturbances for just if we're having to wake up multiple times at night to get up and pee. That obviously then affects a lot of other things with energy and being able to do other things that we want. It's also associated with depression and then an increased risk of urinary tract infections. And just for kind of a specific statistic, those with incontinence are actually 1.5 to 2.3 times more likely to experience a fall than someone who does not have incontinence. So why physical therapy? Obviously, I'm biased. This is what I do. But there are definitely things that can help. So training the pelvic floor muscles effectively for urinary control requires an individualized instruction program to challenge the muscles in progressive ways, different positions, and during activities. And this is, again, individualized based on what you have to do or when you're experiencing some of those symptoms. And a combined therapy is best. Often it's including pelvic floor muscle training, but also some bladder retraining and a lot of education. Again, this is best done under the guidance of a physical therapist who is trained specifically in pelvic floor muscle dysfunction. A lot of PTs have general knowledge of some things, but we get some additional training outside of PT school that really individualizes kind of that pelvic health and who have just much more broad knowledge with this. In a training program, so if an individual were to come to physical therapy, again, varies by individual, but usually requires about 5 to 10 visits, and typically can occur over the period of 6 to 12 weeks or so. So when an individual comes into physical therapy, a lot of times people are really nervous or anxious about that first appointment, not knowing what to expect. We try and make it as comfortable as possible. We talk a lot. The more I understand what's going on with you and what your goals are, the more we can help. So it can be uncomfortable to talk about some of these private factors. But again, we're just here to help. And the more we understand, the more we can do that. For the exam portion, we do a general orthopedic screen. So I look at an individual's back, pelvis, abdominals, breathing, because everything works together for normal function. From there, if an individual is okay with it, and it's always your option, but I do recommend doing a pelvic exam. So we start with just an external exam, feeling pubic bone along the sides. I'm looking for any pain, tenderness, looking for sensation. I'll talk people through a series of contracting and relaxing to see how those tissues and structures are moving. And then essentially I do the same things internally. So the internal exam for a female, depending on what's going on, it could be vaginal exam or a rectal exam. And for males, we would do an internal rectal exam. Again, it's just gives me more of an idea of what's going on. I can feel right on those pelvic floor muscles, looking for any pain. We used a gloved hand, a lubricant, and we're inserting one finger to feel through those structures. And then again, I can feel right on the pelvis and on those pelvic floor muscles as I talk you through a series of contracting and relaxing to make sure those muscles are really doing what they should be or how we may be able to train them better. And then it's a lot of education. That treatment starts day one. Again, an individualized program based on what you're experiencing, your goals, and then the findings from our exam. Education entails, talking through the local anatomy, the muscle retraining, soft tissue extensibility, kind of what I'm seeing with the exam and what we may need to address. We talk a lot about breathing. Diaphragmatic breathing is really important for general function throughout the day, as well as bowel and bladder function. Motor control, so looking at that muscle awareness either through the lower abdominal muscles, pelvic floor, body mechanics for daily activities, lifting, moving, just getting in and out of bed, in and out of a chair. lifestyle factors and habits. A lot of times there's things people don't even realize that they're doing. They're just habits that can affect or at least contribute to the symptoms in some way. And then we address any back, hip, pelvis deficits, whether it's necessary strengthening or mobility, flexibility type things. The bowel and bladder retraining, again, this goes to some of the lifestyle factors or habits, some things that can help improve function. Some external manual techniques. So maybe if we find restrictions in the abdominal muscles or lower back or glutes, kind of through those butt muscles, we'll work through there. Or if there's any abdominal or pelvic scar tissue. We can also do some internal soft tissue mobilization. So either again, vaginally or rectally, either on those pelvic floor muscles, if we're feeling a lot of overtension, pain there, or scars, if there's just not as much mobility through those scars, that we want to get those tissues moving a little better. And then again, that re-education on that pelvic floor, that soft tissue awareness and sensation of being able to tell the difference of when those pelvic floor muscles are activated and more tense and when they're relaxed. So Kegels is a common thing that most people have heard of and done or tried to do on their own. But I get a lot of, I don't know if I'm actually doing it right or what is it? So a Kegel is contracting the deep pelvic floor muscles, which if you can see my cursor along here, so you can see just here shows kind of the more internal. We have got some external tissues here. So those internal muscles are covered, but they are spanning that entire length from our pubic bone in the front all the way back to our tailbone. And they do that on both sides. So they sit kind of as like a bowl in the bottom of the pelvis that supports everything in our pelvis, everything in our abdominal cavity. But they also provide a lot of function day to day and help with bowel and bladder control. So how do you activate these muscles? So for females, it's thinking of gently drawing in or thinking of closing around some imaginary object within the vagina. Or if you think of a drawstring bag, kind of closing that drawstring bag and drawing up and in. For males, same exact muscles through the bottom of the pelvis, there to get more of that localized activation. The first step is drawing in the base of the penis, and then it's a gentle lift of the scrotum. So again, it's that gentle up and in movement. So again, these are a common exercise that most people have heard of. Yes, we talk through them, making sure you can activate those muscles properly. However, this is not the only and definitely not the most important exercise to do for general pelvic health. So that's where seeing in PT specialized in pelvic health will really individualize a treatment program for you. Oftentimes we see people who actually are using those muscles too much, and we have to retrain them to relax to be able to get a proper contraction when we need. So sometimes they are weak, but sometimes they're overutilized, and that's where that individualized program can really be beneficial. So breathe, right? It's something we all have to do. Every system, every organ in our body needs oxygen. But we can do it automatically, so we don't really have to think about it. And so a lot of times our breathing changes over time. A lot of times what people do is hold their breath through movements like lifting something heavy or getting out of a chair. Again, a lot of times this is unintentionally and not even aware that they're doing that. But when we do that, holding our breath through those movements, it increases the abdominal pressure. And then that pushes down on everything in the pelvis, on the bladder. And if that bladder is more full or already kind of irritated, it's like a balloon and it wants to leak out. So we want to try and avoid that pressure down there. So it's breathing through movements. So taking a breath in and then exhaling as you stand up or exhaling as you lift. That diaphragmatic breathing too, it's breathing through the rib cage, that lower rib cage, and breathing in through your belly to actually get proper lung filling, but then also good movement through everything in your abdominal cavity and pelvis. And we get a good, gentle movement and relaxation of the pelvic floor as we inhale, and then exhale, that gently lets go. So that breathing is really, really important. Other things, so fluids in general, people should be getting about half their body weight in ounces of fluid per day for proper bowel and bladder function. A lot of people will restrict drinking fluids to avoid having to pee as often or having that leaking. But that can also cause other issues. So it's really important to continue to get those fluids. Also not straining. So again, when lifting, breathing through those movements, but not straining for bowel movements. Really try and breathe, relax, just let the bowels do their thing. Using a toilet footstool or a squatty potty is kind of the one most people have heard of, but it's just putting us in a better position that our bowels can empty. And again, getting fluids and good diet and fiber. So through whole grains, fruits, vegetables, legumes, and then physical activity, just movement throughout the day. Our bodies are made to move and they need that movement for regular function. There are some great community resources out there. The ADRC, or the Aging and Disability Resource Center, is one that usually has options within counties. So the Eau Claire one is the one I'm most familiar with. But a lot of various counties have similar things, or you can link in with others. Some of these, they were all in person, and then COVID, things did have a virtual option. Now there's some mix, some still offer virtually, some are in person. Strong Bodies is one that is for a general strengthening, functioning, preventing falls. And then Mind Over Matter is one of their programs that specifically focuses more on bladder function. So some of the things are similar of what we've talked about here today. Can be great options, but again, if it's something that you're having more issues, definitely seeking out, talking to your primary care provider about what you're experiencing and options there. With that, as far as if it is something that you're wanting to get in to see. So every insurance is a little bit different, but most insurances require a referral to physical therapy from insurance. So talking with your primary care provider, specifically asking if you can see a pelvic health physical therapist, and getting that referral. It is something that is covered by insurances. We can justify that medical necessity. It affects quality of life, health. So it is something that insurance companies will cover. So definitely, if you're experiencing any of these things, it's not something that you have to live with. Bowel and bladder issues, pelvic plane, intimate issues can be common throughout life, but it's not something that you have to accept as that new dysfunction or problems as that new normal. Physical therapy can provide many benefits and improvements on quality of life, again, through that individualized program addressing your specific concerns and goals. We have a few providers throughout Marshfield Clinic Health System that do provide pelvic health within the Chippewa Valley, which I'm most familiar with. So again, I'm at the Oakwood Center in Eau Claire. Kristen is in Chippewa Falls. We have Bridget in Altoona. Kathleen and Emily Tietzen are in the main Eau Claire area, and then Michelle is up in Rice Lake. Because training differs, some individuals will see everything. So I see all pelvic health, males, females, pelvic pain, bowel and bladder. Some individuals either just see females or just see certain diagnoses. But again, that's something that just talking to your doctor, getting that referral, and then within our system, we coordinate, we know who sees what, and we'll get you with the best individual to treat your concerns. And we also have people around kind of the main Marshfield area. So multiple people within Marshfield, Park Falls, Wausau, Beaver Dam. So again, these are just some of the individuals who do treat within our system, but you don't have to ask for a specific person, just get that referral in, and then we'll get you set up with one of us. So thank you all for coming. I hope this was beneficial, helpful information. always just remember you're not alone. We're here to help. And then this is my information with the clinic I work at, and phone number for setting up appointments here.
Oh, great. I did, as I mentioned at the beginning of the presentation or in the introduction, we did receive a handful of questions in advance. So if it's okay, I'd like to ask those. And then if anybody has a question that they want to ask Amanda, you're welcome to submit that via the chat feature. I will start with this one. Do pelvic exercises help the urinary incontinence if there's a vaginal rectal fistula? I probably
Yeah.
butchered that.
Yes. Nope, you're good. Fistula. Yes.
Oh.
So yes, it can still help. There are, depending on kind of the location of it, and that's something that within, your OBGYN or doctor, if there's other potential things that they want to address. But definitely, if urinary incontinence is the main concern, definitely pelvic floor exercises will help. Again, that can be something of if you see a pelvic health specialist, they can individualize that treatment to you based on what concerns you're experiencing. And then knowing like how you respond to different exercises, movements, what helps, what maybe doesn't feel so great or you feel like makes things worse. They can use that information to, again, just individualize that program to make it the best for you. But yeah, they definitely can still be beneficial.
Okay. So another question was, as a female well into menopause years, is there anything that can be done to prevent irritation and shrinkage of the pelvic area?
Yeah, so that is very common with our hormones change as we age, and that decreasing estrogen is actually the main kind of culprit of that. We don't have that same elasticity of those tissues, so they don't stretch and rebound as well. So there can be local estrogen creams. Physicians will sometimes prescribe, and I've had a lot of individuals that feel that that just helps the tissues, and sometimes that can cause just some that shrinkage or that lack of estrogen can cause just some irritation, like a raw feeling, and that estrogen cream can help. Coconut oil is one that is safe to use and often recommended by even a lot of OBGYNs as a moisturizer, can help decrease any irritation related with that. Strengthening muscle, just movement gets tissues moving, strength. So that can somewhat be beneficial. But it's mainly that lack of estrogen that causes some of those soft tissue changes.
Okay, we did receive a question. Hopefully do you use biofeedback? I'm not sure what that is.
Yeah. Yep. Biofeedback is. So, I do have a biofeedback unit. Honestly, I don't use it a lot. There's great research out there supporting it, and it can be used for different things of either trying to get more muscle activation, or oftentimes it's quieting those muscles down. So what biofeedback is it's kind of just an external output. So we put either electrodes on the skin externally, kind of outside the anus there. There can be some internal vaginal sensors. I don't use those much because you really can't do anything movement wise. You have to be lying down. But then it puts an output onto a screen of kind of showing like what the muscles are doing. It's not a direct like maximal strength test, but it will just give a little bit of that feedback to help kind of retrain those systems a little. So I don't use it a ton, but do have it. And there are some physical therapists who do use that a lot.
Okay, how about one more question here? Do the physical therapy exercises for urinary incontinence also help with bowel incontinence?
Yes, definitely. So again, within that pelvis, those muscles span from the pubic bone up front all the way across the bottom and attach at the coccyx, the tailbone in the back. So it's the same muscles that control bowel and bladder. So a lot of the exercises will be very similar. A lot of other things can go into bowel incontinence too, if it's, gas, some of that of, yes, strengthening those muscles. If there's more loose stools, that diarrhea, really watery, we really want to get a handle on that composition of that stool so it's not as loose. So then we talk through a lot of fiber things or factors of other certain foods causing irritations to also help. So it's not just the muscles, but again, some of those lifestyle factors that can help with any bowel incontinence.
All right, well, I think with that, we will go ahead and close. But of course, if there is any other questions that anyone has following today's presentation, please feel free to send those our way, and we will try to work with Amanda to get those answered. Thank you, Amanda, for joining us today. We really appreciate having you here for this topic.
Yes. Thank you, and great questions. And again, any direct questions or to just take that extra time to talk to your primary care provider and ask some of those additional questions of what might be available, and be an advocate for yourself of specifically asking for PT can be great.
All right. Thank you again. Be well, everybody. We'll see you next month.